Most of us don't think twice about our urine. It's something we flush away without a second thought, part of the daily routine we barely notice. But what if I told you that your urine is like a built-in health monitoring system? A daily report card from your body that can reveal early warning signs of some very serious illnesses, sometimes weeks, months, or even years before other symptoms appear. And here's the incredible part. Checking it doesn't require a doctor, a test, or any special equipment. You can start paying attention right now, today, for free. Welcome to True Vital. If you've been with us before, you know we're all about giving you clear, science-backed health information you can use in your everyday life. If this is your first time here, I'm glad you found us, because today's topic could literally save your life or the life of someone you care about. We're talking about 6 warning signs you can spot in your urine that may indicate something serious is happening in your body. Now, I need to make something very clear before we dive in. Just because you notice one of these signs doesn't automatically mean you have a serious illness. There are many harmless reasons your urine might look, smell, or behave differently. What you eat, how much water you drink, even certain medications and supplements. But if these changes keep happening or come with other symptoms, they should never be ignored. The earlier you notice a problem, the earlier you can get help. And early detection is everything when it comes to your health. Let's start with the first sign: blood in your urine. Sometimes it's very obvious. Your urine might look pink, red, or even tea-colored. Other times, it's so faint that you can only detect it through a urine test at the doctor's office. This condition is called hematuria. Blood in your urine can happen for many reasons, some harmless and temporary, others very serious. A urinary tract infection, for example, can cause a small amount of bleeding. Kidney stones can scratch the lining of your urinary tract and cause visible blood. But it can also be a sign of more serious conditions like kidney disease, bladder cancer, or prostate problems in men. Here's the key point. Blood in your urine is never normal. Even if it appears only once, you should take it seriously. I once heard about a man who saw blood in his urine after a long run. He thought it was just from the physical activity and ignored it. Months later, after the symptom returned, he was diagnosed with an early-stage bladder cancer. The good news was that it was caught early enough for treatment. If he had ignored it again, the outcome could have been far worse. Now let's move to the second sign: unusually dark urine. Normally, the color of urine ranges from pale yellow to deep amber, depending mostly on how hydrated you are. The yellow color comes from a pigment called urochrome, which is a natural byproduct of breaking down hemoglobin from old red blood cells. When you're well hydrated, your urine is light and clear. When you're dehydrated, it gets darker and more concentrated. But if your urine is consistently very dark, almost like tea, cola, or brown, and you're drinking enough fluids, it could be a warning sign of something more serious. Dark urine can be caused by liver problems such as hepatitis or cirrhosis. It can also indicate a buildup of bilirubin, a yellow substance your body creates when it breaks down red blood cells. If your liver isn't working properly, bilirubin can build up and spill into your urine, changing its color. In some cases, dark urine can be a sign of muscle injury from extreme exercise, a condition called rhabdomyolysis, which can damage the kidneys if not treated quickly. The third sign is cloudy or murky urine. Sure, it can sometimes happen after eating certain foods or when you're slightly dehydrated, but persistent cloudiness can be a sign of an infection in your urinary tract or bladder. These infections can cause white blood cells, bacteria, and even pus to appear in your urine, making it look cloudy. Sometimes it comes with other symptoms, like burning when you pee, an urgent need to urinate, or pain in your lower abdomen or back. Infections that start in the bladder can travel up to the kidneys if untreated, and kidney infections are far more serious and potentially dangerous. Cloudy urine can also indicate kidney stones or sexually transmitted infections that need medical attention. The fourth sign is strong-smelling urine. Now, urine naturally has a smell, but you probably noticed it can change based on what you eat or drink. Asparagus, for example, famously gives urine a strong, distinct odor. Coffee can do it too. But a persistent, unusually foul, ammonia-like or sweet smell can be a clue to underlying issues. A sweet, fruity smell is sometimes linked to uncontrolled diabetes, where excess sugar is spilling into the urine. An ammonia smell can point to dehydration or a urinary tract infection. Very strong odors can also be linked to liver disease or metabolic disorders. The key here is persistence. If the smell doesn't go away after a day or two and you can't connect it to something you ate, it's worth getting checked. The fifth sign is foamy or bubbly urine. This can happen once in a while if you urinate quickly and with force. That can temporarily create bubbles. But if your urine is consistently foamy, it can be a sign of protein in your urine, a condition called proteinuria. Your kidneys are supposed to keep protein in your blood, where it's needed to build muscles, repair tissues, and maintain healthy function. When the kidneys are damaged, protein can leak into your urine, creating a persistent foaminess. Protein in the urine is often linked to kidney disease, which can be caused by high blood pressure, diabetes, or other underlying health conditions. Left untreated, kidney disease can progress silently until it becomes life-threatening. The sixth and final sign is a sudden and noticeable change in how often you urinate. Maybe you're going far more often than usual, or maybe you're hardly going at all. Both can signal problems. Frequent urination might be a symptom of diabetes, an overactive bladder, or a urinary tract infection. Infrequent urination can indicate dehydration, kidney failure, or urinary blockages, which can be caused by enlarged prostate in men or certain types of tumors. It's important to know your own normal pattern and pay attention when that pattern changes suddenly for no obvious reason. Of course, not every change in your urine means you're sick. Eating beets can turn your urine pinkish red. Certain vitamins, especially B vitamins, can make it bright yellow. Some medications can change its color or smell temporarily. That's why the key is to look for changes that last more than a couple of days and don't have an obvious cause. The beauty of paying attention to your urine is that it's one of the easiest health checks you can do. You don't need to wait for a doctor's appointment or special equipment. You just need awareness and the willingness to notice. By catching early signs of kidney disease, liver problems, diabetes, infections, or even cancers, you give yourself the best chance at treatment and recovery. So let's go over the 6 signs one more time. Blood in your urine, unusually dark urine, cloudy or murky urine, persistent strong odor, foamy or bubbly urine, and sudden changes in how often you urinate. Your body speaks to you in subtle ways every single day. Learning to listen even in something as simple as a bathroom trip, can give you the power to take action before small issues turn into big ones. If you found this video helpful, tap the like button so more people can learn about these warning signs. Subscribe to True Vital for more science-backed health advice you can actually use. And share this with your friends and family, because you never know who might be ignoring a sign right now that could save their life if they paid attention. Remember, your health is your greatest wealth. Protect it, and it will protect you.